It was discovered back in Lyme, Connecticut. But did it exist before that?
Yes, it did. It was also discovered in biopsies from the Ice Age, from men in the 1800s. I have an article right over there.
So it has been around. It's like anything. As we get more knowledgeable, we start figuring out something that sounds like something, but maybe there are more than one cause. Is that correct?
Yeah.
So arthritis was the tip-off in Lyme, but now we know it presents in so many other ways.
Sure, it can present as chest pain, it can present as urinary frequency, trouble urinating, it can present as a change in vision, floaters, blurry vision. It can also change flu-like symptoms. It could present as bipolar with mood changes.
I heard of a case of someone who was diagnosed with MS, and for some reason was put on antibiotics for another reason, and the MS got better. Antibiotics don't cure MS; they cure Lyme disease. So maybe that person, in retrospect, had Lyme disease undiagnosed. Is that possible?
Yes, I had a gastrointestinal patient who presented, a 12-year-old girl who presented with soiling herself, encopresis. And by the history, I was very suspicious of Lyme, so I put her on doxycycline. During the 2 weeks she was on doxycycline, her soiling stopped. And as soon as we stopped the doxycycline, the soiling came back. It did an antibiotic did the opposite of what it was supposed to do, because usually if you're on antibiotics, it changes your gut flora and you might get diarrhea. But in her case, she had central nervous system Lyme, and by treating the infection, that particular area that was involved, that wasn't talking to her rectum, improved on antibiotics, and she was able to have normal bowels.